Welcome back to our COVID-19 webinars. I'm Deepak Shrivastava. Today I'm going to discuss a very important topic for expectant mothers. This is the time of anxiety for them. As we are going through the crisis, people are still continuing to be pregnant. They are delivering every day. They are breastfeeding, and there are multiple questions. There are a lot of anxieties and questions that have been asked, and our attempt today is to answer those queries. The source of information for this video is from the CDC and also the American College of Obstetricians and Gynecologists. In case you don't know what the COVID-19 is, it's a new viral illness. Just like previously you heard the bird flu or the H1N1 swine flu that affects the lungs and the breathing. These typical symptoms are fever, cough, and troubled breathing. New symptoms have been discovered, which are nausea and diarrhea in about 60% of people, and a sudden loss of smell or taste. If you have one of those symptoms or all of those symptoms, you may be infected with this virus. However, in 80% of the people, this disease is mild and self-limited and goes away. Symptoms tend to appear 2 to 14 days after the exposure to the virus, and there is a period of without any symptoms, which we call the incubation period. So from the time the virus would infect somebody, and it will take 5 days, 6 days, about a week, they are still shedding the virus and infecting others, but they will also not have any symptoms. And that stage is considered at this time very dangerous and probably responsible for the pandemic, the way it is spreading in the United States. The interesting part here is, and kind of difficult part for the providers, is that some of the physiologic changes that occur during the pregnancy, including the nasal congestion, we call rhinitis, or physiologic shortness of breath because of the many changes that occur in the human body when a woman is pregnant, they interfere with evaluation process by the providers. So symptoms can be overlapping, let's say, in terms of the shortness of breath. Pregnancy also is a state of relative immune suppression, and it can impact sometimes the assessment of the severity of the symptoms on the part of the providers, and they have to have no threshold to suspect that there may be a COVID-19 related disease going on. The reason being that there is a decreased lung capacity, again, just for a simple reason, if you ignore anything else, is the gravid uterus and its size that pushes onto the chest cavity and causes the lung capacity to be reduced. In addition, there is relative inability to clear secretions during the pregnancy. And as it is, this COVID virus, once it affects the upper airway, it does cause a lot of secretions. It's very difficult for the person to generate enough airflow to clear those secretions. A very important question that causes a lot of anxiety is my baby going to be all right? And some of the studies which have come out from the Chinese experience shows that there are a number of conditions that can occur, which is no different than other conditions, complication ranging from about 2% to 10%. However, the incidence of the preterm birth, the baby being born sooner than their estimated date of delivery, is about 40%. They looked at 84 pregnant women, 55 of them actually had COVID-19, and the data came from there. Again, this is not clear right now if COVID-19 can pass to the fetus during the labor and delivery. As we go along, the information will be clear, but at this time, I suggest that we exercise all the precautions that are recommended for a normal person, regardless of their pregnancy status. So if somebody is pregnant and they are recently diagnosed with COVID-19, what they need to do? Standard precautions is the way to go at this time. Stay home, except to get medical care if that's what is needed. Avoid public transportation. Call your providers before going to their office. Let them know that you are recently diagnosed with COVID-19, because special preparations have to be made in order to receive you there for your safety and the safety of your providers, as well as the safety of your baby. Get medical care if you feel that you are getting worse, so your symptoms are not improving, or you think and you believe that this is an emergency. You have to not hold back and reach your provider as soon as possible. Stay from other people when you are at home so that you don't infect them, and wear a face mask when you are around people and when you are going out to get medical care. Kaiser Foundation has a very nice model to address a question: what will happen to my prenatal and postnatal visits before I deliver? Well, we are living in an electronic world and there are virtual appointments. So prenatal appointments can be done over the phone, over the video calls and such. We call it telemedicine. At home, monitoring can be provided for the baby's birth weight and blood pressure measurement of the mother, expectant mother, or the blood sugar measurements. And consultation with other specialists can be also arranged the same way. After the baby is born, lactation support as well as the other postnatal visits can be done over the virtual clinic or electronic media. Both for the prenatal and postnatal mental health care and other routine care, it can be provided through the virtual model. So you don't have to worry about the prenatal and postpartum care visits because that will be arranged for you by your providers. Do I have to make any changes for my delivery plans? In most cases, the timing and method of delivery, whether it's going to be vaginal delivery or C-section, it does not need to be changed. But if somebody is sick with COVID-19, probably your provider will decide not to proceed with the C-section at that time unless it's really required. What about home birth in this situation? Well, American College of Obstetricians, Gynecologists still believes that safest place for delivery is a hospital-based birth center, or independent birth center, which is accredited by the ACOG, or American College of Obstetricians and Gynecologists. Well, we know that every woman has a right to choose where they will give birth. But at the same time, it is important for you to make sure that you don't take any risks due to the high chance for getting an infection with COVID-19. Once the baby is born, question is how to avoid passing COVID-19 to my baby. Well, again, the standard precautions: wash hands before touching the baby, wear a mask when you're breastfeeding, wash hands before touching any breast pump or bottle parts, clean all pumps and bottle parts after the use. So common precautions and common sense as described, as have been told to everybody, that needs to be followed very, very rigorously. Can COVID-19 pass to a baby through breast milk? So far, there are no studies. Nobody has found any virus in the breast milk. But again, we do not have enough information on that, whether breast milk has the virus or whether it can be passed to the newborn through the breast milk. It's very important to understand, however, that breast milk provides the protection against many illnesses and infections to the newborn, and also it's one of the best sources of nutrition for the newborn baby. So I encourage that you continue and consider to continue breastfeeding and nursing your child. Stress and anxiety is a natural occurrence in situations like this. And common answer and common sense answer will be that stay connected with your friends and family over the phone or online. Take breaks from the coronavirus related news and social media because they are the major source of the anxiety. Tell your OBGYN or healthcare provider if you do feel sad or anxious. At the bottom of this slide, I have the information about where you can seek help during the distress. There's an 800 number that you can call and also text them, and they get back to you within a short period of time. There are other resources, especially one on the top is Postpartum Support International Helpline. They have a website, there is a toll-free number, there is a text number both in Spanish and English, and they provide support, education, and local resources for the postpartum women. So you can utilize that website and their number, that resource for some help. And then there is another organization that is the National Domestic Violence Hotline, if that's the case, unfortunately. The pregnancy and delivery is a very good time in a woman's life with a lot of hope, happiness, and time for joy. And I hope that with this information, you will be able to maintain that happiness, that joy, and it will alleviate some of the anxiety that you may have experienced during these days with the coronavirus pandemic that we are going through. I wish you good luck and enjoy your new bundle of joy whenever it arrives. Thank you. It depends on the area. It depends on the local hospital policy or the birth center policy. It also depends on the state, what the governing law is at that time. Having said that, it's important to understand that if you are told as a spouse to stay out of the delivery room, that is probably done after a lot of deliberation and following the current policies. But it is possible that they will allow, because at home you are there with your partner, and so it depends on the local conditions at that time. And don't feel frustrated if you are not. I fully understand the value of being present in the room for a variety of reasons within the family, but at the same time, your safety, your spouse's safety, and your newborn child's safety is utmost important. If they have been diagnosed and they are asymptomatic, that means if they did not have a fever without the medication for 3 days, 72 hours, their symptoms have resolved if they had any symptoms. And it's been 7 days since their symptoms have appeared. So they don't even have to have a test in the current guidelines, and they can go home with the baby and enjoy as such. If it is not the case, then they have to wait and stay in the isolation until they clear and meet all 3 conditions that I just suggested. I think for most expectant mothers, this is a very difficult time, but at the same time, this is, you don't get pregnant every day. So, for someone, it may be a newborn first baby, which is coming, and they are looking forward to it. They should continue to enjoy this time and just take all the precautions and be very attentive to what's being said, and keep in touch with your provider, because they will definitely guide you in terms of what to do. Anxiety is a natural part, but then again, as I said, talking to friends and family is really important to alleviate the anxieties.